Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent mandibular second molar. We will start with some basic points like the terminology, position, function and tooth numbering, followed by the chronology, dimensions, surfaces, line angles and point angles. Then we will look into the detailed morphology of the tooth from different aspects. So starting with the basic points. The term molar is derived from the Latin word mola, which refers to millstone, a pair of large flat stones used for grinding food. So these teeth are called molaris dens in Latin and molar teeth in English. Now coming to the position of the tooth. The permanent mandibular second molar is the seventh tooth from midline. It is present posterior or distal to permanent mandibular first molar and anterior or mesial to permanent mandibular third molar. So in this picture, if we draw the midline, then the seventh tooth 1, 2, 3, 4, 5, 6, 7. The seventh tooth is permanent mandibular second molar. It is present anterior to third molar and posterior to first molar. Often in some people, when the third molar is not erupted or is extracted, then the mandibular second molar is the posterior most tooth. Next, coming to the functions of the tooth. The permanent mandibular second molar supplements the permanent mandibular first molar. That is, it helps in crushing or grinding of food into small pieces, maintaining vertical dimension of occlusion and supporting the facial muscles. Now moving on to the tooth numbering system. As per the FDI system of notation, the permanent mandibular second molars are denoted by the digits 3-7 and 4-7, where 3-7 denotes permanent mandibular left second molar and 4-7 represents permanent mandibular right second molar. So in this picture, the mandibular second molar on the left side will be denoted by the digits 3-7 and the mandibular second molar on the right side will be denoted by the digits 4-7. Next, in the universal system of notation, the numbers 18 and 31 are used to represent permanent mandibular left second molar and permanent mandibular right second molar respectively. So here 18 represents the 3-7 tooth or the left second molar and 31 represents the 4-7 tooth or right second molar. Lastly, in the Zsigmondy-Palmer notation system, the symbols 7-7 or 7-7 are used to denote the right and left second molar respectively. That is, the right and left second molar respectively. Now coming to the chronology of the tooth. The permanent mandibular second molar erupts at the age of 11 to 13 years after mandibular second premolar, which erupts at the age of 11 to 12 years. The first evidence of calcification is seen at around 2.5 to 3 years. The enamel formation is completed by 7 to 8 years and the roots are completed by 14 to 15 years. Next, we will look into the dimensions of the tooth. The overall length of permanent mandibular second molar is around 20 mm, of which the crown is around 7 mm long and the root length is 13 mm. The mesiodistal diameter of crown at crest of curvature is 10.5 mm and at the cervix it is 8 mm. The buccolingual diameter of crown is 10 mm at the point of maximum convexity and 9 mm at the cervix. Now let's understand the surfaces, line angles and point angles. Similar to other posterior teeth, the permanent mandibular second molar have 5 surfaces. These include the buccal surface, the lingual surface, mesial surface, distal surface and the occlusal surface. Then there are 8 line angles. These include mesiobuccal line angle, distobuccal line angle, mesiolingual line angle, distolingual line angle, bucco-occlusal line angle, mesio-occlusal line angle, linguo-occlusal line angle and disto-occlusal line angle. And lastly, there are 4 point angles. These include mesio-bucco-occlusal point angle, disto-bucco-occlusal point angle, disto-linguo-occlusal point angle and mesio-linguo-occlusal point angle. Remember that the point angles are formed by the intersection of 3 surfaces. On the other hand, the line angles are formed by the junction of 2 surfaces. Now let's study the tooth morphology in detail from different aspects, starting with the buccal aspect. The crown presents only 2 cusps, that is mesiobuccal cusp and distobuccal cusp, and there is no distal cusp as seen in the mandibular first molar. These 2 cusps are almost equal in width and are separated by the buccal developmental groove. The buccal developmental groove is short and ends within the occlusal third of the crown. So when compared to permanent mandibular first molar, there is no distal cusp, only one developmental groove and no distobuccal developmental groove. Cervico-incisally, the crown is shorter than mandibular first molar and mesiodistally, the crown is narrower than mandibular first molar. Also, the buccal cervical ridge is not pronounced as seen in mandibular first molar. Now coming to the crown outlines. The crown is trapezoidal in shape with the shorter side towards the cervix and longer side occlusally. Mesial outline of the crown is convex with maximum convexity at the center of the middle third of the crown. The distal outline is also convex with maximum convexity at the center of middle third of the crown. Occlusal outline is formed by the cusp ridges of mesiobuccal cusp and distobuccal cusp and is interrupted by the buccal developmental groove. The cervical outline in many cases points sharply towards the root bifurcation. Now coming to the lingual aspect. The crown presents mesiolingual and distolingual cusp. These are equal in width and sharper than the buccal cusp. There is a lingual developmental groove that separates the mesiolingual and distolingual cusp and runs onto the lingual surface. Now coming to the crown outlines. The crown is trapezoidal in shape with outlines similar to that of the buccal aspect. That is, the mesial outline and distal outline are convex. The occlusal outline is formed by the 2 lingual cusps and is interrupted by the lingual developmental groove, and the cervical outline may be straight or curved apically. Now coming to the mesial aspect. The mesial surface is convex for most of its part and may be flattened near the cervical line just below the mesial contact area. From the mesial side, the mesiobuccal and mesiolingual cusps are visible and the crown shows a lingual inclination over the root base. Compared to permanent mandibular first molar, the cervical ridge is less pronounced, that is, the buccal cervical ridge is less pronounced. Second, occlusal surface is constricted buccolingually, that is, the occlusal surface is constricted in the buccolingual direction, and the mesial contact area is at the center of the mesial surface. That is, the mesial contact area is at the center both cervico-occlusally and buccolingually. Now coming to the crown outlines. The crown is rhomboidal in shape. The buccal outline is convex in the cervical third and becomes flat occlusally. The height of contour is in the cervical third of the crown. On the other hand, lingual outline is uniformly convex from the cervix to the mesiolingual cusp tip, and the height of contour is in the middle third of the crown. The occlusal outline is formed by the mesial ridge of mesiobuccal cusp, mesial ridge of mesiolingual cusp, and the mesial marginal ridge. The cervical outline is almost straight and regular in outline. Now coming to the distal aspect. The crown presents distobuccal and distolingual cusp, and similar to the mesial aspect, the surface is smooth and convex. Compared to permanent mandibular first molar, there is no distal cusp and distobuccal developmental groove. Also, the distal contact area is at the center of the distal surface. That is, the distal contact area, similar to mesial contact area, is at the center of the surface both buccolingually and occlusocervically. Now coming to the crown outlines. The crown appears rhomboidal in shape and the outlines are similar to the mesial aspect. That is, the buccal outline is convex in the cervical third and becomes flat occlusally. Lingual outline is uniformly convex from the cervix to the distolingual cusp tip. Cervical outline is straight and regular, and the occlusal outline is formed by the distal ridge of distobuccal cusp and distolingual cusp and the distal marginal ridge. An important point to note here is that the distal marginal ridge is present at a lower level than mesial marginal ridge. As a result, some of the occlusal surface may be seen from the distal aspect. Now coming to the occlusal aspect. The tooth appears rectangular in shape with opposing sides nearly equal in length. The mesiodistal width, which is around 10.5 mm, is greater than the buccolingual dimension, which is around 10 mm. However, the mesiodistal measurement buccally and lingually is almost equal as the tooth does not taper much lingually. Most of the second molars present more curvature on the distal sides than mesially, resulting in a semicircular outline on the distal side and a square outline mesially. Now moving on to the elevations seen on the occlusal surface. Mandibular second molars have four cusps, that is mesiobuccal cusp, distobuccal cusp, mesiolingual cusp and distolingual cusp. There is no distal cusp as found in mandibular first molar. The mesiobuccal cusp and the distobuccal cusp are almost equal in size, while the mesiolingual and distolingual cusp are well developed. Then there are mesial cusp ridge and distal cusp ridge on each cusp, and in general, the buccal cusp ridges are flat while the lingual cusp ridges are more well defined. Also, each cusp presents a triangular ridge that converges towards the center of the occlusal surface. Lastly, we have the mesial marginal ridge and distal marginal ridge. These are well developed and forms the mesial and distal boundaries of the occlusal surface respectively. Now moving on to the depressions. The permanent mandibular second molars present two fossae that includes the mesial triangular fossa present distal to the mesial marginal ridge and distal triangular fossa present mesial to the distal triangular ridge. Then there are three pits. These include the central pit at the center of the occlusal surface, mesial pit in the mesial triangular fossa, and distal pit in the distal triangular fossa. Then we have three developmental grooves. First is the central developmental groove that runs across the occlusal surface from mesial pit to the distal pit. Second is the buccal developmental groove that extends buccally from the central pit onto the buccal surface, separating the two buccal cusps. And lastly, we have the lingual developmental groove. It extends lingually from the central pit and separates the two lingual cusps. So if we look closely, the buccal and lingual developmental grooves meet the central groove at right angles and forms a typical plus mark, which divides the occlusal surface in nearly 4 equal parts. Lastly, as found in other posterior teeth, we have multiple supplemental grooves that radiate from the main grooves in the mesial and distal triangular fossa. So that was all about permanent mandibular second molar. In the next video, we will take on another topic of dental anatomy. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content.